When we started this study, we recruited patients who were diagnosed with Parkinson's disease already, as well as healthy control subjects. And these healthy control subjects were either the caregivers who accompanied the patients to the clinic or were other medical staff at the USC hospital and the Movement Disorders Clinic. And we collected their tears with something called a Schirmer's test strip, which is a strip that's clinically used to measure tear flow. So it's a little piece of filter paper that's placed under on top of the lower eyelid, and over a period of 5 minutes, it wicks the tears onto the strip. It's a very non-invasive test, which is important because these patients experience a lot of tremor, and we don't want to put anything sharp next to someone's eye who is experiencing tremor. And then we take the strip away and elute the proteins, and we measure what changes in a certain spectrum of proteins occurred. What we found were that there were fairly significant changes in a protein called oligomeric alpha-synuclein. So oligomeric alpha-synuclein is an intermediate in the formation of something called the Lewy body. So when patients are diagnosed with Parkinson's disease, one of the characteristic pathological features is the Lewy body formation, which is found in the brains of patients with Parkinson's disease. This is found actually on autopsy, so it's not something that can be diagnosed in real time. We did actually measure both what we call basal tears, which is in the absence of any stimulation. These are tears that are taken under topical anesthesia with an eye drop. And then we also measured without anesthesia, which does involve a little bit of reflex stimulation of the cornea, which is really just the touching of the Schirmer strip to the cornea. And interestingly, we found that the levels of oligomeric alpha-synuclein and the difference between the healthy controls and the Parkinson's disease patients were higher in those reflex tears, which engage the nerves to a greater degree.